Hello and welcome back to Ask the Doctor. I'm your host, Mike Berger. Our guest today is Dr. Charles Powell of Healthcare Associates of Irving, and we're examining Medicare, healthcare, and wellness for all of us over 55. We'd like to remind you that you can join in. Just call the number you see on your screen. It is 1-877-563-0099, or email us your questions to cpowell@healthcareassociates.com. Okay, the phone lines are open, and we're going to start out with Darla in Fort Worth. Darla, what's your question?
Yes, I am a new Medicare recipient as of December 2012. I am wondering, as a person who is disabled, if my children will also be rolled into the Medicare program, one of which is a 20-year-old full-time college student. The other is a high school student, 16. So just wondering if they will go into the Medicare program automatically with me.
Okay, that's a good question, and I won't claim to be a Medicare specialist, but to simply tell you that typically the Medicare program is for the recipient itself. It does not, it's not really there to take care of the dependents in there. However, there are numerous state systems, such as the Medicaid system, that are there to help take care of dependents when there is a disabled parent.
So this lady really needs to talk to a Medicare specialist who can get her on the right track and
Absolutely, absolutely. And you know, as a new recipient of Medicare, now's an opportunity for you to really explore not only what Medicare can do for you and learn all about that, but also the Medicare Advantage programs to see what they have to offer for you. If they can't offer care directly for your children, they can at least get you in touch with the right agencies to get the care in that direction.
I remember when I turned 65, I thought, gosh, I know enough about this, and then I started getting all the information, and I didn't know anything about it. So,
absolutely,
sure want to check with folks. The phone lines are open. Bob is with us from Fort Worth. Bob, what's your question?
Can you explain what the drug donut hole is and how this affects the care you deliver?
Absolutely, and that's really evolved over the years. Wonderful question. You know, prior to 2003, there were not any coverages for prescriptions under Medicare. These were out-of-pocket expenses for a lot of these people. In 2003, when it came into play, they designed the program with what was called a donut hole in the prescription program, where up to a certain amount of money, the recipient had a little bit of responsibility, and then all of a sudden, between this, what they call the donut hole, there was no coverage of prescriptions at all. Now, right now, those numbers come out to up to about, I believe, about $2,900 of coverage. And then between $2,900 and $4,700, no coverage. And then that's considered a catastrophic cap. And then after that, their coverage picks up again. So the question was always, what do you do in that donut hole? Because in the first several years after the start of the program, this was a very busy time for providers delivering Medicare products. Right about this time was when everybody came in and said, I'm out of money. I'm in the donut hole. I can't afford these medications. You've really got to help me. What can we do here? Well, the system was designed that way not to be inhumane. It was designed that way to show that there was a finite amount of money to take care of people, and we needed to be responsible with it. And so this is where, again, the doctor, the patient, and a lot of times even the insurance company become part of a team to try to find the most cost-effective means to keep people from getting into that donut hole. Now, I'll tell you, the first few years of it, it was a lot of free samples, and it was a lot of hard times, and a lot of people just flat out went without medication until the plan reset on January 1st. But since then, we've had the opportunity to really change their prescriptions, maybe to more generics, or to combine medications, or to lessen what they really need to be on to deliver effective care. Now that is only a small part of my practice this time of year when that donut hole comes up for some people. It's nowhere near the problem that it was years ago during its inception.
But it can be scary when you reach that point and all of a sudden it has to all come out of your pocket.
I mean, like, we're talking about people that are on a fixed income, and to suddenly be told that they have, you know, the next $1,300 of expenses out of their pocket, they didn't plan for that.
We have a question from a viewer at our website. Cindy in Plano would like to know, what are the most common causes of hospital admissions that could have been avoided through consistent visits with a doctor? That's a good question, and going to become a more important question, isn't it?
Absolutely. You know, we were talking before the show about how my career started off, where largely I was doing, you know, several admissions every night for, you know, acute heart attack or for a stroke or something along those lines. Now we're really focused on trying to take care of the patient before that becomes an issue. I would say the majority of hospitalizations are preventable if the person is taken care of in an appropriate time before that. It could be years before that admission, but attention has to be given to their health care at that time and not waiting on the symptomatic endpoint. And I stress symptomatic endpoint because there's all these what we call silent killers in medicine.
Sure.
The high blood pressure, the high cholesterol, that often aren't symptomatic but lead to these problems down the road.
That brings up the old line everybody uses, if I'd have known I was going to live this long, I'd have taken better care of myself.
Absolutely.
The phone lines are open. Patsy's with us from Dallas. Patsy, your question.
I'm a disabled veteran. I suffer from fibromyalgia. And since I'm not able to exercise because of the muscle pain, I'd like to know what I can do to have a better quality of life.
That's a wonderful question. You know, fibromyalgia can be such a challenging disease state to deal with because there are such limitations on what we can do for it. There's still a poor understanding about fibromyalgia itself. Several medications that are out there to help with some of the pain and discomforts associated with fibromyalgia. But actuality, the studies have shown the most reliable thing is a healthy lifestyle and exercise. So your question is very valid, but if it hurts too bad to get to the point of exercise, what can I do? And the answer is enroll in a very good program with someone that can help ease you into a physical medicine program, and in the end, that will benefit you as well.
Exactly. We're going to take a short break, and then we'll be right back again. You can call us with your questions at 1-877-563-0099, and there's the email address as well. We'll be right back.